Dr. Jila, thank you so much for being here at the Gisela podcast. How are you today?
I'm great. Thank you for having me. I'm so excited to be here.
I'm so happy that you're here, and I am actually very honored because the work that you do for us women is so powerful. And I would love to know the story of how that started. How did you start really helping women with their health?
It's a long journey, to say the least. I've been practicing OBGYN for over 20 years. And most of it has been here in South Florida. So I trained in New York and I came down here after residency back in 2004. So I've been here a long time, delivering lots of babies. Throughout the journey, a lot of my patients kind of grew up with me. I've seen them through their reproductive phases, getting married, having children, following them postpartum. And now they're entering into this midlife journey of, hormonal fluctuations and chaos per se. And I was seeing a lot of missing pieces of the puzzle where they would have these issues happening, whether it was with their periods and their cycles, or if it was they just didn't feel right. They couldn't pinpoint really what was going on with them. And, I'm talking about patients who are in their 30s, early 40s, not really anyone where you would associate with the big M, the menopause stage. And so it was a little bit concerning because we didn't have answers for them. So I really wanted to hone in and see what's happening and why is this going on with them. And so I realized we were great as providers in terms of gynecology, surgery, delivering babies. But when it came to this next stage, we kind of were at a loss. And the things I could provide patients was minimal. And I knew that wasn't okay. It goes back to our training way back in, the 1990s, 2000s, where I'm sure you've heard the Women's Health Initiative study that came out. And that shifted a lot of education in terms of how we treat women in midlife and menopause and perimenopause. And because of that, it impacted us as providers, which then in turn impacted a whole generation of women not being supported or getting the care they needed. So it kind of became a passion project for me to change that narrative and to understand what's happening and what can I do about it to improve women's lives. And so fast forward, here we are. And this is kind of where I'm segueing into next, is just taking care of the woman after her reproductive years.
This episode is brought to you by Balangi, a wellness brand dedicated to empowering women to balance their hormones naturally and reconnect with their bodies. You can learn more at balangi.com. That's so beautiful. And it really amazes me. I'm a mom of two. They're now 6 and 8 years old. And when you have a baby, you are with that serotonin. There's like so much love, but there's no sleep. We are with this beautiful energy, and I can still smell it actually. Mm-hmm. But we're sleep deprived. Mm-hmm. Of course. How didn't we get a manual of what should happen next? And I love that you are really doing this because it is so necessary. From my perspective, now that I feel at this moment balanced, I think for so many years, I was unbalanced. Mm-hmm. And I don't think a lot of people point at hormones, mm-hmm. but now it's such a popular word, right? Hormones and correct. Perimenopause and menopause, like mm-hmm. you hear it all the time. But yeah, so happy that you are really doing this work, because really a lot of women not only need to know that they're not alone, mm-hmm. but to take action. Right. Because it's not, oh, I'm not alone. No, it's okay, you're not alone, but this is what you should do. Right. Love it. Mm-hmm. Can we start with, what are hormones? What are hormones?
Let's just start from the beginning, yes. Right? I think what we need to understand as women is we all have and have had estrogen, progesterone, as well as testosterone in our bodies throughout our lives. You're born with all of that. Your ovaries make those hormones. And those are the female sexual hormones that we talk about so much. Just like you have other hormones in your body, your thyroid releases hormones, your adrenal glands release hormones, the ovaries are just another, organ that releases those hormones. And it is what helps us thrive. It's what helps us go through puberty and then get pregnant when we're ready for fertility purposes. And afterwards, it really is for our bodies to help, protect the heart, to help protect our bones, and to help protect our brain function going forward. Mm-hmm. The difference is women are living longer and longer these days, and hence the ovary kicks out or gives up around the average age of 50, 51, hence menopause. And there are no more hormones in our system. And it starts to decline in late 30s, early 40s. Some women, it's really actually the progesterone that starts to fluctuate a little bit at first. Then comes the estrogen, and testosterone is the last one that we become deficient in. So the way that presents in women is the progesterone gives you the moodiness, where they are shorter than they used to be. They're short-fused, short-tempered, kind of, things aren't rolling off their shoulders anymore. And they feel overwhelmed with the same daily functions that they were able to manage before. Like you said, mom of young kids, you're taking them to school, after school activities, doing everything else, working during the daytime, and then going back, picking them up, taking them home, homework, dinner, bedtime routine. You're able to manage all of that. All of a sudden now, at this juncture, you're finding yourself kind of struggling a little bit and you don't know what's going on. And that, as women, we're conditioned to just push through. We can do anything. We'll be okay. I just didn't get enough sleep last night, so I'll make up for that. So we tend to just really, we carry a lot of things on our shoulders as moms, as women, as partners, as, being in the work field. So we tend to put ourselves as not a first priority, but a last priority on that list. And so when those hormones start to fluctuate in midlife, that's when it starts to affect your functioning, your quality of life, and your relationships. And I want women to tune into that and realize they need to kind of know what's happening in their bodies in order to be able to translate that to their healthcare provider.
So beautiful. And, I always say I have 3 priorities, just the top, I have other things, but first is my self-care, my self-regulation, my nervous system, protecting my nervous system. Then it's my family, and then it's my business. Mm-hmm. And spirituality and God, it's, like all wrapped in.
Right. It's every component of that. It has to be.
Yeah. My faith is there. We sometimes tend to victimize our world, what's happening. I thought my mom was going to help me and she's not helping me. Or I thought this, and I was there. I was victim mode. I was just very, I couldn't believe all the expectations I had. And then I became a mom and everything started dissolving.
Right.
And there was one day that I needed to make the decision because I was just using postpartum as my gateway to treat people a certain way I'm exhausted. I just had a baby, you know, all these things. I'm breastfeeding. I couldn't stand myself. I really couldn't. I'm like, I need to change.
Right.
There's something I can't live with this anymore. So I really started diving deep in like a lot of inner work. And with that came, I need more support. I'm gonna get support, I'm going to hire somebody. And even now with this wisdom, because you have to go through it and you have to snap out of it. The more I grow in either in my business or anything that I do, the more support I need. Doesn't mean that I'm not there as a mom. I'm always there as a mom. We're always there, Correct. But yeah, I think what you're saying is like very, very important.
But that's the thing is, as we get older, we become wiser. And it's kind of part of the territory that you're in now. It's okay. I know what works. And again, Does it work for everybody? No. Are they all the same? Is every woman going to have the same journey? Probably not. But some will get to it sooner than others, I think. And what you said before, which is women need to understand they're not alone. You're not the only one. Everybody's going to go through it. If you're a biologic female, you will go through this at some point in time. And understand that there are people out there to help, and there are things that you can do to help yourself.
So beautiful. You mentioned, let's talk about the top hormones.
Mm-hmm.
You mentioned estrogen, progesterone, and testosterone. Today, it's because of social media, there's so much information, and a lot of people are either self-diagnosing or putting on doses. I don't know a lot of that area because for me, I've done things naturally. Not that, I love both worlds, but I've heard, and I know this is like a weird question, but maybe it's not weird for you. You've heard probably every single thing, right?
Right. I have, and there's no such question.
I was at the gym the other day, and there were women talking about, oh yeah, I'm doing hormone therapy. And then somebody's like, oh yeah, my friend was doing testosterone. And then she just realized that, did she say vulva or her labia? It got bigger. And that her voice got
changed.
Deeper.
Correct.
Is that normal, or is that like overdosing?
Okay. Yeah. I'm glad that you brought that up, because I think we need to, discuss it a little bit more. And women need to understand that there are different modalities of treatment options for hormone therapy. It used to be called HRT, or hormone replacement therapy. We're switching that to menopausal hormone therapy or hormone optimization therapy. One and all the same. What is happening is there are topicals, there's oral. So let's start with the estrogen. You have oral estrogen that you can take. You can do a topical or pellets. The oral is great. It's easy to take. It's just a pill every day. There's a couple of doses. You can play around with that. The problem with that one is if somebody has a history of a blood clot or a clotting disorder, because of its first pass through the GI tract and the liver and the metabolism there, they are at a higher risk for having a clot or a stroke. So we really want to stay away from that. So most providers are doing transdermals these days. So that could be a patch, that could be a cream, it could be a gel, or it could even be a mist, or even have a ring, a vaginal ring that could be placed. So that could be the estrogen component of it. The progesterone component tends to work best as an oral capsule that you take nightly or cyclically, depending on where you are in your perimenopause or menopause journey. There are some women who don't tolerate oral progesterone. It makes them groggy, sleepy. And so we can try transvaginal route. There are compounding pharmacies doing creams. They will work. The problem with that might be in some women is the absorption of it. And so we don't know the absolute levels of serum that they're getting and whether it's protecting the lining of the uterus, which is really the goal of the progesterone, as well as sleep. Testosterone is where it gets fun. To know is to start with testosterone, there is no FDA-approved testosterone formulation for use in women. Okay, so that's the first mic drop there. There's about 7 different formulations for men. So what we do is we use men's formulations, but at a female dosage, which is about 1/10 of the dose. There's a gel, and there are compounded creams of testosterone that we can use, as well as subcutaneous or the pellets. When women are talking about pellet therapy, there's 2 components to that. It's your estrogen and your testosterone that are placed subcutaneously or under the skin. And the reason women like that is a multitude of reasons. One is ease of use. It's placed and you don't have to do anything for 3 months, basically 3 to 6 months, depending on how your body metabolizes it. The other benefit that we've noticed, and I provide all kinds of therapies, so I feel confident to talk about it, is that it will increase that testosterone dose quite rapidly because of the way it's inserted and the way your body absorbs it. So they get a high. So they really like that, that energy, libido, going hard at the gym. it really kicks in quickly.
By the way, before you begin, because the conversation started, my friend like literally built 3 businesses with testosterone.
Yeah, that's exactly the reason why, is that boost of energy that they get. Imagine your testosterone is dwindling and now you place a pellet and it shoots you right up almost overnight. And so they kind of like that rush. And it's okay. The problem is, over time, what we've noticed is your body can build up tolerance to it. And so you may need higher and higher doses. What happens there is you need to check serum blood levels before you do the next insertion. And sometimes your body doesn't clear it completely, so you can overdose to 2 to 3 times physiologic doses, which is where the irreversible side effects come into play that you noticed your friend was discussing, is changing and deepening of the voice. And the other part is the clitoral area starts to enlarge. Some women, the clitoral megaly is the biggest part. So they get like a micro penis. The other areas can grow as well. It's just engorgement of that tissue, but it's really the clitoral enlargement that can affect them quite a bit. And that can become problematic. And these are not reversible. That's the caveat with pellets. Again, but we're talking 2 to 3 times where they should be on their blood serum levels. So when I do it, I'm very conservative, very particular. I check levels before the next insertion, and we make sure we don't overdose the patient. So knock on wood, haven't had that issue, but there are some women that it can happen in for that. And again, the last part of it is, it's the most costly form of hormone replacement therapy because insurance doesn't cover it. So it's self-pay. So to avoid all of that, I use my first line therapy for women is a transdermal. So it's a patch or a cream or a gel, and the oral progesterone and the topical testosterone. That's kind of like the regimen that I start most women on, depending on their symptoms. And then we tweak as we go and kind of tailor and personalize it to them within 6 to 8 weeks.
What age do you find mostly, like, is it starting at 35? Do you see mostly like starting at 40? What is the age?
It varies depending on the patient. Some women, because of their background history of genetic mutation, so they're a breast cancer gene carrier, and so they need to have surgeries done to reduce their risk of developing cancer in the future. So they undergo surgical menopause at the age of 35 or 38. That patient will need to be started on hormone therapy right away so they don't have severe symptoms, because imagine having hormones one day and pretty much in 24 hours, you don't have any. And that can affect their body, their cardiovascular and their bones and their brain a lot more significantly than somebody that goes through natural menopause. So that is one population that we really need to be focused on and take care of them well, which I do with my oncologist at the hospital, where, we have a teamwork going on, and we discuss the patient prior to their surgery. We discuss their options, so that way they're already prepped for it before they actually undergo the procedure. Apart from that extreme situation, a lot of women, late 30s, early 40s, will start having some symptoms, and they will come in, and depending on what the symptoms are, I personally like to start more natural and holistic and dial in their nutrition, dial in their diet, supplementation, other routes of things that we can do to calm down their symptoms and kind of regulate the hormone imbalance. And then as they go through their journey and then the symptoms become more significant, then we can add in the hormone therapy. So it could be 45 and on. It could be somebody who's 50. So it's really variable.
It really varies by their lifestyle and their symptoms and,
where they are and how some women, it's really quality of life. That is the biggest takeaway is, what is it affecting your quality of life? Are you non-functional? And if the answer is yes, and you've done everything else, then now we start. But if your quality of life is off and you haven't done anything else for yourself in terms of self-care, then that's really where we need to focus before just adding in hormones, because hormones aren't the magic cure-all for everything. It's not going to fix everything overnight. And that is a little bit of a misconception that women tend to have is, well, I'm on it, everything's not better. Well, we need to work on other components as well. It's all together.
Yes. 2 questions they asked me on my social media, and I'm like, I'm just going to ask Dr. Jila. The first one was, I'm new to all of this. What hormonal blood work, like what is the what is the blood test that I need to do? And the second question somebody asked me is, I was prescribed progesterone and I feel I'm gaining weight and I'm having water retention. Is this normal? And I'm like, I don't know. I'm going to ask Dr. Jila.
Perfect timing of the questions, right? So the blood work, again, just so you understand, in medicine and especially in women's health and this component of women's health, a lot of it is variable. So it changes and it shifts and there are no absolutes, okay? Very few. And it's all more like a gray zone, no black or white. Somebody in perimenopause, it's really going to be difficult to kind of pinpoint that they're going through perimenopause by doing blood work. The reason I like to do blood work in that time frame, so perimenopause, we're talking about someone who's late 30s, early 40s, they still have periods, but they're having other symptoms. Or if they're having periods, their periods are more irregular than they used to be. Either they're skipping 2 or 3 and then they get their cycle, or they're getting them and they're heavier or lighter than they used to be, or they have no cycle irregularity, but they have every other symptom going on. So in that time frame, to check labs really isn't going to confirm or deny that they're in perimenopause. The reason I like to do it is there are other things going on that can mimic perimenopause, such as iron deficiency, can kind of mimic some of the symptoms of perimenopause, as well as a thyroid dysfunction. So it's not per se just to look for perimenopause. I'm looking to see if there's anything else going on that I need to treat first before looking at hormones. Now, you're later, you're 50, 51, haven't had a period for 6 to 8 months, and you're having all the symptoms. That's more likely late perimenopause or menopause. Again, definition-wise, menopause is 1 day of our lives. It's 1 day after 12 months of not having a period. The following day is considered post-menopause. So most women are in post-menopause or in their peri. So women in menopause, post-menopause, their hormones will show it. So you can do a hormone panel. Your follicle-stimulating hormone level will be quite elevated, and your estrogen level will be very low, as well as your progesterone level. And testosterone is going to vary a little bit because, like we said, it tends to dwindle off towards the end. So I would, if anything, you go to your provider, ask for at least a complete panel of labs, including hormones, thyroid, and iron panel. That would be the
all of
start.
Okay, amazing. If somebody feels, I don't know, it's going to be like a weird question because I'm not in.
You're not there.
I don't think I'm in perimenopause. And well, I'm going to tell you my story.
Okay.
And obviously I'm not on menopause, but are there women that are transitioning from perimenopause to menopause without any symptoms? Like it's just, yeah, but no, is it possible?
There are some women who are lucky enough where it isn't as significant and it doesn't affect their quality of life as much. Now, it could just be genetics. It could also be their lifestyle is honed in, meaning they're eating clean. They are out there getting sunlight. They are moving every day and they're more in tune with their bodies. Of course, they're going to be okay. And it's not going to be as significant for them. Okay. But variation.
I love that you said they do sun. So many people are afraid of the sun nowadays.
Oh yeah.
I love the sun.
We need to be outside. There are certain things that are non-negotiables. Movement is one of them. Sunlight, daily sunlight, and connections. You need to have these 3 things because there are studies done on all of them that show the benefits versus the people who didn't have them and how their lives, and longevity is affected going forward.
So beautiful. And talking about connections, because I think a lot of people, when they hear that, it's like, and they're probably going through a moment, I'm sure I have been there, where I felt that I didn't have any friends. I felt that I was going through many of my hard moments alone, you know, and it's really not about that. It's about finding community, going to wellness conferences, go to that yoga class, that sound healing, whatever, you know, whatever you see that your soul is telling you and is sparking something, like do it, and do it alone.
Right.
Because sometimes people get caught up like, oh, I don't have a friend to go this with. No, do alone, and following that intuition and that journey that your soul that has to go through. That's where you're going to find meaningful connections, where you're going to learn, grow, or stick around. Like, who knows, right?
Yeah. So as we get older, and you're not there yet, but I can see that your soul is already there, like within you. We need to become more curious and care less what others think. Basically, you kind of evolve to this place where there's no judgment. You do what feels good for you. So if that class is something that's going to serve a purpose for you, check it out. You never know what's going to happen. You may meet some amazing people that are along this journey with you. Just because a friend from 10 years ago isn't going along this journey the same as you doesn't make them any worse or better of a friend. They're just not there yet. And so we need to expand our circles, basically. And we have friends from different phases of our lives. And that's how it should be looked upon. And I think connection really changes it. And when you meet the people who are on the journey at the same place you are, you know it right away.
Yeah, it's very powerful.
It is.
And it doesn't matter if it's a short-term connection or a long-term.
Right.
It will impact your life.
It will serve the purpose.
Exactly.
Absolutely.
What do you think about having healthy boundaries to protect your peace and I think healthy boundaries come when you have this awareness of your nervous system, how it is, like, is it, are you saying yes to everything? Are you just trying to please everybody? Like everybody needs to like you, all these things. What is healthy boundaries to you? And how do you implement them?
Yeah, it's a lot harder to do than, to implement that, because we are people pleasers at the end of the day, right? Where, you just want to make everybody happy, especially me. Like, that's my whole goal, is I don't want anyone to be upset with me. So I will, go above and beyond. And what I've learned to do is kind of tone it down a little bit. My job is quite demanding, and right now I'm in fluctuation, so it's even more so. And I've learned to just kind of take some time, think things over, and say, listen, this isn't going to help or serve me at this point. Please keep me in mind and let's talk later. I've had friends who are like, listen, we can do these events together, but can we do it later? Absolutely. So there is no rush, and self-care is number one priority. We have to move that up, because if we're not doing well, there's nothing else I can do. And so I've learned it's self-taught. We're, again, evolution, right? And so we're getting there little by little.
Yeah. It's like, it's a muscle.
Yeah.
It's a muscle. And I've had many experiences where I was going to not do something for my daughters, and I had to take a step back, and I'm like, but why am I doing it for them? But like, really, is it really from fear? From like, what is it here? So I really had to like scarve, let's say, to do my yoga teacher training right after my divorce. Okay. So imagine my state of mind, where I was really looking to just go deep and be in that moment of pause and breath. Right. And then I was like, let me see what are the benefits, and let me see what are the cons. And the benefits were larger. This is going to be great for me. And if it's going to be great for me, it's going to be great for my kids. Right. So these weeks is just going to be an investment for the upgrade that I felt the call to do. And this is just one of the examples. Exactly. If anybody is listening to whatever you feel the call, because a friend told me the other day, before having kids, I wanna go deeper on. I want to do more healing, and I'm like, I didn't want, I shouldn't, I just said, I should have just listened, but something in my soul told me, say, the healing starts when you become a mom. Not the healing, because some women, you know, they make the decision to not be a mom, and there's other ways and lessons, and everybody has their own journey. But if you want to be a mom, like there's a whole new layer of healing that is gonna open up. So that happened to me. So why leave things for later if you can do it?
Well, that's a whole definition of procrastination. If you know you need to do it now, just do it. It's harder to do, but once most things you do afterwards, you feel better. And that, okay, I did accomplish that and whatever it was, and now I'm going to move forward from it. And a lot of times our journeys are not linear. There's a lot of curves thrown in there and detours per se, and you end up where you're meant to be. And so I think, you know, with women, that's definitely true, where we never really know where we're going to be. We have an idea, and it's just a matter of how you curate that out and see how it evolves.
Yeah, for sure. Everybody has their own journey, and I want to tell you my story so you can just know a little bit about me and how actually Balangi was born. I'm a person where I take seriously, and I don't want to take I don't want it to sound so like but for me, spirituality and doing this inner work and being self-aware, but not only awareness, but also taking action. So I guess just having consciousness in everything that I do is super important. And, you know, we all go through things. And I was somebody that also, with time and maturity, I needed to understand a few things that I really needed to work on, like trauma-based and all these things. That, by the way, do you agree that a lot of the imbalance that maybe happens in a woman is from the things that they haven't worked on themselves?
100%. Unresolved issues, trauma, whatever have you, childhood trauma, secondary trauma. That's a whole another podcast episode.
Part two. When I had my first baby, well, actually, when she was inside of me, I was so scared. I love being pregnant, by the way. I really love. With the second one, I loved it too, but it was harder. Okay. Because I already had the first one. Yeah. But when Stella, she's 8 years old now, when Stella was inside of me, I was so happy. But at the same time, I was so scared, and I didn't understand why I was so scared. So one day I was walking in the supermarket, and I ran into somebody. Her name is Gabby. And we just started talking, and I told her just, you know, I'm good. I love being pregnant, but I'm scared. She's like, maybe there's something that you need to tap into. And she's a healer, you know, she does clavitherapy, reflexology. She's very conscious. She's wonderful. And by that time, I would do yoga, but I wasn't very deep in I didn't have my spiritual awakening. Okay. When I had a session with her, she started doing clavitherapy. Have you heard of it? I have, yes. She started doing clavitherapy, and she explained to me, like, if you don't feel it, maybe there's something blocked. Okay. So she would be like, do you feel this? And I would be no. And then she would do something else. And then, do you feel it now? And I said, yes. And all I decided, I remembered that I was raped. Oh, wow. And it's not that I didn't remember, but I had blocked it in a way that it wasn't part of my reality. Okay. It was there. I knew it happened, but I didn't heal it. I didn't do anything to work on what happened to me, you know? Right. So I went to my now ex-husband that night, and I told him. And he opened he's like, I love you even more. And I don't know, other people are like, why aren't you with him? You know, like life happens. But for me, it was like kind of like a decision that I had to make. I need to work on this because I don't want to pass it on. So moving forward, then came my divorce. And now I'm like, okay, now this inner work still needs to be going on, and even on a deeper way. But after my divorce, my hormones, and I have were all over the place. My adrenal fatigue was
through the roof.
I felt so tired. It was this new way of parenting. It was also my other business. I wasn't feeling inspired. I didn't want to work. And then finances, everything started like crushing to me. And all of a sudden I'm like, pause everything. I needed to pause. And I said, I'm going to just focus on me. I'm going to focus on my health. I hired a functional doctor. I can't just do it by myself. I'm like just guessing all these things while my nervous system is up the roof too. So I started doing all these modalities, but my migraines and painful periods were very present. And I'm like, this can't be happening. And I was just praying. I'm like, you know, I'm not going to normalize this, but I'm going to surrender to whatever it is. So I came about with wild yam, Chaste Berry, and I've known of many of the hormonal balance, like these herbs. I've known them like with capsules, powders, all these things. But it was the first time I put it on topically. Within the first week, I started feeling so good with my mood. And 3 months later, I noticed that I haven't had painful periods and migraines. My migraines were literally the aura, and then I would have to just go to bed. I couldn't do anything that day. And we're still now in 2025, and I don't have painful periods since 2023. And I still pinch myself. I quite don't understand it. I do understand the science behind the wild yam and the Chaste Berry, but I feel great, you know? So this is my story, and I want you to share, you know, if somebody's going through migraines, through painful periods, and they're doing all the things, because that's important. They are noticing that their nervous system needs a checklist, you know, and needs to, they notice that they know that their nutrition, that they're doing all the right things, but they're still having these things. What do you say to them?
If all the things are in order and they're, you know, still experiencing symptoms, that I do like using supplementation to help kind of bridge the gap until they're ready for hormones. In some women, that will work if they're not sleeping. We supplement with magnesium at nighttime, and that helps them sleep. And so we're avoiding sleeping medication and other medications that you really shouldn't be on. So that is one thing. Let's say, okay, so we fix the sleep component. If they're, you know, having mood issues or, you know, just irritability, things that they can't get control of. Again, it's more, you know, let's get to the bottom of it. What is changed? And a lot of times I can pull out stressors in their life that they weren't even paying attention to. And they're like, oh, you know what? This has changed. And so we work on that. Again, there's a lot of therapy components involved with, you know, midlife women's healthcare, because number one, if they feel heard, that's half the battle. So like, they're like, okay, this person knows, cares, and wants to help, versus just being dismissed, which is what's been happening over the past 2 decades. So, you know, getting to the bottom of things, trying natural supplementation, food modifications. We know the benefits of the yam. We know this. We've known this forever. Now, is it going to be enough to protect the bone and the heart? No, it's not going to be. That's, you know, we only have the bioidentical version of estrogen, but is it enough to get you through, to calm down everything and kind of recalibrate your hormones to the point where you can function, and then at a later point, look at hormone therapy if that's right for you, 100%. So I love the natural component of things coming into play. And this is, you know, there's Western medicine, you know, conventional medicine, and then there's Eastern medicine. And functional medicine, you know, longevity care, all of that. And this is a first time in, I don't know, years, decades, where there is a crossover of the two. And, you know, woo-woo medicine, things like that is what, you know, you're told, but there's something to it. And that's why I'm like, no, I got to learn more about this, because my patients need it. I want to know. I want to know more. Well, why is this working better? And why are these supplements where we should start, or these herbs where we should start first before jumping? Because some women aren't ready for that yet. And so I think it's a nice balance and a complement to everything that they're doing. So love it.
You mentioned, so what are the top 4 supplements that every woman needs? And we're talking about, let's say 40 and up.
40 and up.
I'm 40, so 40 and up. I'll be 41 soon, so I'm going to say 40, 40, 40, 40. Yes. So much this month.
That's actually the best time, to be honestly, for all of this, because you're ahead of the 8 ball. So you're going to be well-versed and ready to go with this. And it's not going to impact you as heavily as other women, from like a generation ago.
Because there was not enough information before.
Exactly.
I mean, definitely my mom didn't have like a lot of information. I'm actually sending her information now. I'm actually sending my mom information.
Yeah. And that's what ends up happening. Every time I do a talk or something, the women in the audience are texting their moms. This doctor says you can still take hormones and you can do this, and there are other things you can do. And so there is a place for it, even in the older population. Let's say somebody who's in their 60s, you can't just write them off and say, no, you can't. Sorry, too late. There's a conversation there to be had. In terms of someone in their 40s, the top 4 or 5 supplements, and I don't believe in supplements. I don't believe in like a whole tray full of, supplements, because I don't think that's where it's at. Vitamin D3 and K. Okay.
Why?
Because the vitamin D3, being outside in the sun, you need that, and the K helps it get absorbed into the bloodstream, so it affects the bones where it's supposed to be working to protect the bone from deterioration and osteopenia. Calcium is the other component to it. We don't really need to supplement if you have a great diet, because you're going to get a lot of it through your diet. But if not, then I would recommend a supplement. And I like, again, very natural things. And there's a calcium chew made out of dates, and it's very clean and organic, and it's seen calcium chews. I have them. They're delicious, and they're made with dates. And it's made by a pharmacist who herself, after having a baby in postpartum, found out she has osteoporosis in her 30s. And hence she went out to buy a calcium supplement to help herself, and she couldn't find anything on the market that was clean. And so she decided to make one. So she did. And now it's a big company.
That's so awesome, because that's exactly what happened to me.
Yeah. If you can't find it, you make it.
Yes.
And that's where it comes into play. Yes. The power of women and the power of innovation.
Wow, with dates. I would never know. Okay, amazing.
So the vitamin D3 and K, calcium, omega-3 fatty acids. We hear about this all the time. It's good for the brain. It's good for the heart. It's good for inflammation. So you need it. If you can get it in your food from fish or, fish oils, great. Otherwise, a supplement is amazing. Whole Foods has a lot of good products there. So I recommend, the Whole Foods brand. And the last one is magnesium that we were talking about. And actually there's one more I have to say, creatine. It's become a big buzzword out there, but it's a good product. It's a good supplement. It's not for the gym component anymore. It's not just for muscle maintenance and growth and this and that and pushing you harder at the gym. It's actually for bones as well as brain and cognition. So it comes into play. There's a lot of promising studies coming up with creatine. So those are really my top few that I would recommend.
That's awesome. I take, I guess, everything except I haven't thought about the calcium component. Yeah. So
take a look at her company. You'll like it.
Okay, I will. I don't know. I have learned so much when it comes to low progesterone, because I did have low progesterone. I have learned a lot, and I always say this, and I know a lot of people are going to be like, but I wonder, because I've read many studies, what if low progesterone is one of the causes of divorce? Because women can't stand their husbands. Correct. Maybe they're so tired.
Right.
They're so unbalanced, with the hormones, and primarily progesterone, which you mentioned at the beginning, which it's like
it makes sense. It makes sense. Yeah.
I heard that, and I'm like, ooh, I wonder. I'm like, I wonder, but no wondering.
So it's interesting that you say that, because let's go back to the divorce rates, right? It's over 40% in midlife. And it is affected because this midlife shift isn't a one-sided equation. It's both parties. It affects you, but it affects them as well. And men are lost. It's not their fault. Just like we didn't know what was happening, they have no idea what's happening to their partner. They're like, this is an out-of-body experience. This is not the person that I've been living with and that I loved and I married.
Yeah.
So it does affect them quite a bit. And a lot of them, men, they don't know what to say. They don't know what to ask. And they usually tend to say the wrong things. And in women,
like no emotional intelligence.
It is, I have two boys and I'm trying to teach them better, but it is part of, the way it is. And not all men are like that. Let's not generalize. I don't want to get, man bashing. I'm not doing that. Okay?
No, we're not doing that. But, by the way, my ex is amazing. So I would never say anything bad about him.
Right. And my husband's very understanding and my kids are really good. My boys understand menopause and everything very well. They're in their early 20s. So they're going to be well versed for the next generation of women. They're lucky. But in terms of the progesterone, yes. So remember, progesterone is a hormone that helps with mood and balance and sleep. And if your moods are off and your progesterone is fluctuating a lot, which is what it does in perimenopause, you are going to be short-tempered. You are going to not have a fuse and you're just going to blow up at everybody. And have you seen the memes on social media where it's like, why is he breathing? He needs to stop breathing. I can't stand the way he's breathing. Those are real. We all relate to it because we've all felt it.
Yeah.
And it's kind of not our fault because your body's acting up in a way that you don't know how to control it anymore. So does it relate? Yes. Indirectly, yes, it will get you there if you don't find someone to help you out and kind of balance things out.
Yeah, no, for sure. I mean, obviously, a divorce is not only because of low progesterone.
Right, exactly.
Okay?
Yeah, let's not go there because then on Giselle's show, she said progesterone causes divorce. No. There's a lot more components to it.
No. But it is one thing that I would. Okay, let's say there were many reasons why I got divorced, and it was actually mutual. But if somebody at that time would have told me, maybe it's because you have low progesterone, I would have checked my progesterone. I would have done a blood work. Right. I would have done all the things, and I would actually try when my progesterone was up, I would have tried. But maybe I didn't have to do all of those things because I needed to create Balangi.
Exactly. So, I think we all go through our things and what A led to B to C. So who knows?
Yeah. Another question that I get a lot of messages, and I don't know how to respond to this because I don't have it. Women with incontinence.
Yes.
What is happening? Yes. Is this normal? Is this something that can be reversed or it should be just normalized? This is what it is and that's it.
Absolutely
Can you talk about
not.
that?
Absolutely not okay to be normalizing that because there is physiology behind what's happening there. As we were talking about earlier, the lowering of estrogen, the decline in estrogen affects everything. Let's start from the head all the way down to the bottom. We have estrogen receptors everywhere, even on your scalp, on your hair follicles, on your face, the heart vessels that can go to your heart, your bones. Obviously, we talk about that. Vaginal tissue. The same way you notice your skin on your face is changing. It's becoming more dry. It's becoming thinner. The same thing is happening in the vaginal area. And what that does is the bladder is right there. And that bladder wall, instead of being supported by nice elastic tissue in the vaginal area, isn't being supported anymore. So it drops. That drop changes the angle of the urethra or the tube that comes out that allows you to urinate. And hence you will lose urine a lot easier. When laughing or coughing or jumping or doing things that you used to love to do, you leak or you pee, and that's incontinence. What do we do about it? We treat it with vaginal estrogen cream. It is a lifesaver. It is almost like a miracle cure. Why? It's a lowered concentration of estrogen that is placed vaginally. You start with 1 gram every night for 2 weeks. That's the loading dose. And then going forward, use it twice a week.
Okay.
That will elasticize that tissue well enough where everything kind of goes back up to normal. The thing is, it's not only the incontinence component, it's the incontinence leads to recurrent urinary tract infections, which then leads to having infection in the bloodstream from the urine, something called urosepsis. And women can get really sick from that in their 70s and 80s. So it is a whole conglomerate of things that can happen if not addressed soon enough. Let's say you have a 70-year-old, and again, I see these patients all the time, and I have a 70-year-old who comes to me and she says, I have vaginal irritation, itching, and and I keep getting UTIs and they keep giving me antibiotics. It gets better, but it comes back. What's going on? That woman doesn't have anything bad happening, but she does have incontinence because of that tissue for 20 some years now, not getting any estrogen. And we can honestly save her life by starting her on vaginal estrogen cream. And she's shocked when she comes back to me in a month and she's like, I'm not peeing myself anymore. And that itching and irritation is gone. What happened? And that's the reasoning is that tissue down there needs estrogen.
Wow.
Just like anywhere else in your body.
I'm so happy I'm asking this question because it doesn't happen to me, but it does happen to many women. And you know how the question was about? Because I bought like a few weeks ago this vibration plate for lymphatic system, and I'm loving it so much. And like some women are saying like, I don't think I can do that because I haven't. And I'm like, I don't know. Test it. Like I really didn't know what to answer, but I'm so happy that that you're talking about this because I'm all about all natural, but I'm a very curious person, and I'm very like that. If there's something that does that you've seen your clients that are like, oh my God, it's gotta be lifesaver because just having to pee or feeling that pee's coming out all the time, it's gotta be like, you just can't keep talking with this person. Like,
No. Listen, it changes. You know what that does to the psyche is they won't go out in public anymore. They become shamed by it. So it plays a big role for women. Imagine you're out with your girlfriends and now you have to worry about bringing a pad with you. And remember, we as women, now we're sharing more. We didn't before. Okay. There was shame and taboo over all of these topics. No one wanted to talk about menopause. If I talk about that, that means I'm old. I'm not that old. So I'm not, they wouldn't share, especially the sexual part of it. That's the second taboo, is that nobody wants to talk about sexual health. But why not? Are you having sex? Are you enjoying it? And these are all discussions that need to be had with your doctor. Otherwise, you're not going to get the help you need. And these are all things that are happening.
That's so true. And you know what used to happen to me? And I never talked to my doctor about it. Is when sometimes when I would have, and that was when I was married, we would make love, we would have sex, and it would hurt sometimes. Right. What is that? I because like I know it doesn't happen anymore. Why is that? So
the same way the vaginal tissue can cause the bladder to drop if you don't have enough estrogen there. It can cause vaginal dryness, which then shows up as painful intercourse. And then bleeding after intercourse, all of the above. And you know what that leads to?
What?
Low libido, because now the woman has this negative feeling about having sex because it hurts.
100%.
Right? You didn't want to have sex.
No.
But it wasn't him. It was just the fact that you didn't feel good afterwards. It didn't feel the same. So then that translates into lack of interest. It's not complex, but it's very interrelated.
Yeah.
And once you kind of blow the lid on it with a patient, they're kind of like, oh, really? That is this? I'm like, just try it. Come back in a month and let's talk. And they're like, I had sex with my husband and it didn't hurt for the first time. And I didn't have to use a lubricant. And again, this is a medication that's been around for 30 years.
Yes.
This isn't something new. And it is the bioidentical version of it, which is the body-like version of estrogen that we use. And some women will ask me, well, I'm on the patch. Is that going to be enough? In some women, it is. The patch will get into the bloodstream. It'll be enough to cover the vaginal tissue. In other women, they need the patch or the cream, whatever have you, and the vaginal component as well. So they can be on both, because a vaginal cream, the vaginal estrogen, only works locally. It doesn't get absorbed into the bloodstream in significant amounts to cause a problem. So it's safe to use.
I love the conversation that we are having. And although like women, if you're having a symptom, if there's something that you feel shame talking about, that it's from your woman's health, from sexual health, go and find somebody to talk to, you know, and then don't be scared of having treatments, like, you know, and in a responsible way, right?
Correct.
Try to find somebody holistic, somebody functional, and don't normalize symptoms, because there's always a root cause. And if you, like what you were saying, if you don't fix this, then like it's gonna become something bigger, larger and later. Something bigger, you know? So
absolutely.
So super important. And also I'm all about, you know, like I try to be everything natural, but I am the person that if I don't feel good with something, or I want to change something, or I want to do something, like I'll do it, you know? Like those things, like if I had incontinence and I started realizing that I don't want to go out, you know, like I say I am aware, but even if we all have blind spots, I pray for God to show me the blind spots that I can't see, you know, and it will like open up like many things, but to be aware that there's things that we can do. Absolutely. We don't have to stay with that. We don't have to stay home just because we're shameful of something. Go get help, go get support, and change what you need to change. Yes. We already talked about how stress affects hormones, and it's super important to really, you know, have these healthy boundaries and to have this self-care, so you can really attend to your family and to your friends and to everybody around you. Because what's happened is that I know I've been there, and people have done it to me when we are in this burnout, nervous system wreck, we can start burning everybody around us, you know? So to be mindful of that, and also that could maybe fix any imbalance that you have, because maybe the root cause could be
just stress.
Could be stress. Yeah. Was there a moment in your life where you had to scan everything in your life, and even from your career, from your family and everything, that you said, okay, I need to switch something? Was there something that made you switch to, or even if there was a switch, I don't know, to a more holistic, functional way of being doing in your practice? Yeah.
There was, because I can't just take care of women and just say, you know, oh, well, yeah, I need to go see a cardiologist. Oh, like go do that. Oh, your cholesterol is elevated, but I know it's elevated now because it's your estrogen deficiency is causing it. I know what's causing it. Let me at least take a shot at it. And then if there's a bigger problem, then I'll send you to the cardiologist. So it was a lot of that. And what's happened is with women's health, like especially your OBGYN, you look at them as your primary care doctor for most of your life, because we really are. I mean, listen, women in their 20s and 30s, they're not really sick women. And, you know, we can take care of them, and we are considered women's primary care providers. So why is it that now in midlife, when they really need primary care, I can't provide that? And that was the switch for me, where I said, I know enough and I want to learn more. That way I do the right things within my scope of work. I'm not going to do X, Y, and Z. That isn't what I do. But if I can learn and if I can get board certified in it, then of course I'm going to do it. So something like obesity medicine or hormone medicine, these are all things that we can educate ourselves on, and then give it back for our patients. So I think that for me was a couple of years ago where I kind of started this whole shift over and, change the lab work that I do, things. And they're like, wait, those are cardiac markers. What are you doing with that? And my thing has always been, I'm going to do a lab, but I'm going to know what to do with the results of it. I'm not just going to run it just to run it. Yeah. So I think that's where it came in for me.
Amazing. I want to ask you 5 questions and they're very short. What's your favorite herb for hormonal balance?
I love lavender. It's very soothing and calming. And a lot of my patients love it at nighttime. So it helps with sleep.
I have this this balm that has magnesium and lavender. And honestly, like, it's just like, it's amazing. Yeah. Favorite snack for hormonal balance?
It's funny. I love fruit. So I like any berry or any strawberry or berry, and we're lucky in Miami, we have berries year round. They're so full of antioxidants. I love berries. I have them with me all day long.
Yummy. I love berries too. What does exercise look for you?
It's a little bit different for me because I'm not sure if you're familiar with the Tracy Anderson method, but I have been a devotee for 7+ years of the method. And I started the method because, or doing the method, I should say, because of my time restraints. I need to be ready to go at 5 o'clock in the morning. So I would get up at 4:30 in the morning and do my workout and be ready to go for the day by 7 and take the kids to school, whatever have you. And it's an online platform. Hence, I could do it anywhere, anytime. So for me, that worked. And fast forward now, Tracy, what she has done is she has changed the method as she's gotten older. So it's not just one version anymore. There are other things that serve women who are going through the change to build muscle, to build that resistance and, to get all of that and that flexibility that you get. She's kind of combined into one thing. So for me, that's the easiest thing to do. And I've been doing it for so long. I could just kind of maneuver it.
I love Tracy Anderson. Actually, when everything was closed, I was in my balcony just doing her exercises.
Yeah. That's exactly why.
Loved it so much. One myth about menopause you wish every woman could know?
That they're not going to go through it. A lot of people, it's not going to happen to me. Or I'm fine. It hasn't. Everybody will go through it. It's just how they go through it.
Before we close, what's one tip you can give women to help them remember their power?
We are, women as we get older, we think we're done. We think I raised my kids, I've done this, I've done that, that's it. This is actually a second rebirth, I feel, where you're at this point where you have this enlightenment in you, where you're like, I'm just going to do what makes me happy. And the people that it serves are the ones who understand it. And the ones who don't, that's okay too. So don't give up. Like, we have so much more to give back. This isn't the same generation as, 20, 30 years ago. This is a different generation of women. And we're finding our voices and we're going out there and we're getting what's ours.
So beautiful. Before we go, where can our audience find you? I know you have a podcast. Do you want to talk about it? And also a website or your social media?
So the website is just my name. So everything's very closely related. So it's gilamd.com. That's where they can find me. I put a lot of educational information on that site. That way they have access to that. Podcast is Her Time, Her Health with Dr. Jila. It's on Apple and Spotify. And social media is my name, Dr. Jila Senemar. I do a lot of educational things on there, as well as some fun things. And a lot of different events that I attend or I will be hosting here will all be on there. So give me a follow. And
some fun things. Yeah, we need to keep social media fun.
It is. No, it can't be all about education. There's education. There's fun things in there because, again, it shouldn't be that intense. It's not that crazy. We're here.
Yeah, we need to play more. We need to play more.
We have to. Again, this is all fun things that we're all going through, ladies. And it doesn't mean we're done. There's a lot more to do.
Hi, Dr. Jill, thank you so much for being here and sharing everything that you shared today. I know my community is gonna love it, and for me, it was like a lot. It was like a class that I had here with you right now.
I'm
so
glad.
thank you so much.
Thank you for having me. It was great.
Bye.